الله الرحمن الرحيم. هنبدأ مراجعة اللور ليج. وأول حاجة ناخدها the hip joint. Hip joint is a synovial joint between the head of the femur and the acetabulum of the hip bone. If we look to the acetabulum in face, I'll find inside it there is an articular lunar surface, and this is non-articular surface. And this is the acetabular notch, which is covered by a ligament, which is called transverse acetabular ligament. So the head articulates with this articular surface, the lunar surface. This acetabulum is surrounded by a fibrocartilage to deepen it, to make it more deep. And this fibrocartilage is called a labrum acetabulaire. Labrum acetabulaire. To increase the depth of the acetabulum so that the head of the femur can lodge inside it. The capsule of the joint, the capsule is attached to the circumference of the labrum acetabulaire, and anteriorly it is attached to the intertrochanteric line. So the neck of the femur, the anterior surface of the neck of the femur lies entirely inside the joint. However, if I look in a posterior position, I will find this is the head and this is the neck of the femur, and this is the acetabulum. I will find the capsule of the hip joint is attached to circumference of labrum acetabular and is attached to the middle of the back of the shaft of the femur. So the lower half of the neck of the femur lies extra capsular, بره الكبسول. وانتم طبعا عارفين ليه؟ لأن التندون بتاع الأوبتوريتور externus muscle is related here to the lower surface of the back of the neck of the femur to be inserted into the trochanteric fossa, the obturator externus tendon. The most important relation of this joint, that anterior relation to this joint, I'll find the femoral triangle. I'll find the femoral triangle. I'll find psoas major muscle and the pectineus muscle, and this separates the hip joint from the femoral nerve. This is the anterior relation. However, posterior relation, I can find that the muscles of the gluteal region, the obturator internus muscle, two gemelli muscle, quadratus femoris muscle lies at the back of the hip joint, and these muscles separate the joint from the sciatic nerve. So nerve anteriorly and nerve posteriorly. Muscles anteriorly and muscles posteriorly. This is the important relation of this joint. عشان كده posterior dislocation of the joint will affect the sciatic nerve. The nerve can be injured if there is a posterior dislocation of the hip joint, because the sciatic nerve lies posterior. What are the most important movements